Reducing mushroom poisonings from their current levels to minimal background rates requires systemic interventions that go far beyond telling individuals, "Be careful with wild mushrooms." We need comprehensive cultural shifts, educational infrastructure, regulatory frameworks, and accessible expertise that together create an environment where mushroom poisoning becomes rare rather than tragically common. Models exist from regions that have successfully reduced poisoning rates despite maintaining strong foraging cultures, and studying those successes reveals what works. Parts of Europe with low mushroom poisoning rates, despite enthusiastic foraging traditions, demonstrate that cultural practice and safety can coexist when proper systems support safe foraging. These regions often feature mandatory education programs teaching mushroom identification systematically rather than leaving it to informal knowledge transfer. Professional mycological certification systems ensure that people teaching identification or selling wild mushrooms commercially have verified expertise. Free public identification services during mushroom season provide accessible expert confirmation for uncertain identifications. These multi-layered interventions work synergistically. No single element alone would be sufficient, but together they create a safety culture. School-based education represents a critical intervention point because it reaches children before they develop unsafe foraging habits. Age-appropriate curriculum teaching children never to eat wild mushrooms without expert verification, basic outdoor safety rules, and understanding of why mushroom poisoning is uniquely dangerous could prevent many childhood poisonings. This education shouldn't be a one-time lesson, but integrated throughout science education, reinforcing messages as children develop. Schools in regions with significant foraging activity should treat mushroom safety education as essential as fire safety or stranger danger. Public health campaigns during peak mushroom seasons leverage the fact that mushroom poisonings cluster temporally around periods of heavy rainfall when many species fruit prolifically. Spring and fall rainstorms trigger mushroom blooms, and poisoning rates spike in the days and weeks following. Targeted public service announcements, poison control center outreach, and media engagement during these high-risk periods could reach people when the information is most relevant. Seasonal messaging allows for intensive education during critical windows without requiring year-round campaign maintenance. Accessible mycological expertise through university extension programs and mushroom societies provides the expert confirmation that makes safe foraging possible. Many university systems have extension mycologists who offer identification services, but these resources are often underfunded and unknown to the general public who might benefit from them. Adequately funding these programs and promoting their availability could dramatically reduce poisonings. Regional mushroom societies bring together amateur mycologists with varying expertise levels, creating educational opportunities and mentorship for beginners. Supporting these organizations financially and promoting their activities expands access to legitimate mushroom education. Regulation of commercial wild mushroom foraging and sales addresses a significant poisoning pathway where current oversight is inadequate. Mandatory species testing before commercial wild mushrooms enter the food supply could catch misidentified toxic species before they reach consumers. Licensing requirements for commercial foragers would ensure basic competency before allowing people to profit from selling wild mushrooms. Restaurant liability for species verification creates market incentives for purchasing only from certified sources. These regulations need careful calibration to prevent eliminating legitimate wild mushroom commerce while protecting public safety. Barriers to implementation are substantial and must be acknowledged honestly. Funding for mycological education and infrastructure competes with countless other public health priorities. Traditional foragers resist regulations they perceive as restricting cultural practices or criminalizing traditional knowledge. Reaching at-risk populations, including recent immigrants, rural poor, and social media-influenced youth, requires tailored approaches that current public health systems struggle to deliver. And the relatively low absolute number of mushroom poisoning deaths compared to other causes of mortality makes it challenging to argue for substantial resource allocation. Cost-benefit analysis of prevention investment versus treatment costs provides compelling economic arguments. A comprehensive prevention program including education, accessible expertise, and regulatory oversight would cost far less than the intensive care, liver transplantation, and long-term care currently provided to mushroom poisoning victims. Each prevented death saves hundreds of thousands in medical costs while avoiding the incalculable human costs of suffering and family devastation. From a purely economic standpoint, investing in prevention makes fiscal sense even before considering ethical obligations to prevent avoidable deaths. Building effective mycological safety culture requires sustained commitment across multiple sectors: education systems, public health agencies, medical communities, foraging communities, and regulatory bodies. No single intervention will solve the problem alone, but comprehensive multi-level approaches modeled on successful international examples could substantially reduce the mushroom poisoning burden. The goal isn't eliminating foraging, which provides cultural, economic, and culinary value. The goal is ensuring that people who choose to forage do so with adequate knowledge and safety systems that make deadly mistakes rare exceptions rather than tragically common outcomes.